Let's take a closer look at the provincial picture for the vaccine rollout and third wave preparations. I'm joined now by the Western Cape's Head of Health, Dr. Keith Cloete. Dr. Cloete, thank you so much for your time. First of all, looking at the healthcare workers, we know that some 430,000 healthcare workers nationally have received a vaccination, but we also know, or we're told, that there are between 1.3 and 1.5 million healthcare workers nationally. So there's a lot of healthcare workers who still need to be vaccinated. Not under eNCA, because that ends at 500,000, but still, those healthcare workers are our top priority. Do you have any idea of how many healthcare workers in the Western Cape still have to get the jab?
Good evening, Sally, and good evening to the viewers. Sally, we've been working on about 130,000 healthcare workers in this province with the expanded definition of healthcare workers. With eNCA, we are nearing and approaching just over 90,000 will be vaccinated by tomorrow, and if need be by Saturday when eNCA comes to an end. And we're currently projecting that we will use all the eNCA vaccinations available to us in the Western Cape. For us, that leaves a balance of about 40,000. But if you factor in that probably if you reach 80% of the healthcare workers, that takes us to about 105 to 110,000 people. So our balance in the province is somewhere we reckon between 10 and 15,000.
All right. So are you comfortable that the province is ready to start on Monday with vaccinating those older than 60?
We are confident that on Monday we start, and remember we have to do two things concurrently now. If eNCA did end 2 weeks ago, if it wasn't for the 2-week interruption, we would have had 2 weeks to prepare for this, and we would have done 1B, which is to catch up with healthcare workers in the last 2 weeks. Actually, what we need to do now is we have to do the catch-up for the remainder of the healthcare workers and do vaccination for people over 60 as of Monday, which is a tall order, but we are ready to proceed with that.
All right. So for an elderly person who has registered, what can they expect? Must they wait for an SMS telling them where and when to go and get the jab?
Yes, so we're taking a very deliberate approach in this province, Sally. We know exactly, we received 30,000 Pfizer vaccines today, so we know exactly how many it is. We are bringing the sites that we want to bring online incrementally over the next few weeks. So on Monday, we're specifically bringing sites online in the Cape Metro. We're bringing 10 sites online, but the whole purpose of those 10 sites is to start vaccinating the balance of healthcare workers, and the teams at those sites have now already started putting plans in place to make appointments to firstly do outreach to old age homes next week. So our primary responsibility to reach people over 60 is to go to old age homes next week. And in addition to that, we will personally call a small group of people over the age of 60 to test our systems next week. Everybody that has registered has had a regional SMS to confirm that they are registered, will receive their SMS of where they need to be, at which site, what time, what date, in the next 2 weeks. So we're appealing to everyone to say, unless you've been contacted to tell you exactly where you should be and given a date, that's the only time you come forward, and we will get to everyone. And we say that those SMSs will probably go out in 2 weeks' time. And the reason why it's 2 weeks is that we're getting 30,000 today. We're getting 30,000 weekly for the next 2 weeks. We will do the balance of those healthcare workers, as I said. We will do the old age homes, and we will incrementally increase our capacity of more sites so that we can give the older person that comes to our facility a dignified experience. The last thing we want is for people over 60 to queue outside, to put themselves at risk. We want it to be as dignified as it possibly can be.
All right, so you've got about 750,000 60-plus people, as Aisha was reporting. 220,000 only have registered so far. That's really quite low, bearing in mind the registration has been open for some time. What do you put that down to?
We have a very fascinating dashboard at one of our, we got lots of skilled people in this province, and we were really a game changer dashboard was created for us in a very short period of time. And we've pinned it down, Sally, that we can break down now exactly where all the over 60s live in the Western Cape. We match that with all the people that's been registered, and we can go down now to suburb level to see in which suburbs where we expect their 60-year-olds and how many people have registered from that area. So the one big factor is in the most underprivileged and the most deprived areas is the lowest uptake so far. So it is a matter of access, it's a matter of knowledge, it's a matter of ability to be able to navigate. So now we can pinpoint, and as of early next week, the Premier and the Minister has been going around doing that, but now we can pinpoint down to neighborhood level where we can go in. The big success story for us is Overberg as a district, because in Overberg more than 40%, 44% actually, of the people over 60 has registered. It's the highest in the Western Cape. And if they continue that trend, somewhere towards the end of next week, they will hit 50 to 60% of people over the age of 60. The colleagues there shared a very important story. They saw where they took grade 9, 10, and 11 learners and told them, your job is to go into your neighborhoods, find the people over 60 in your streets, in your local neighborhood, help them to register. So there's many ways that we can do it. We will do community development workers, but what we have as an advantage now is the specific areas where the uptake is low.
I see. I have to ask you a quick question because you've given us a really good idea of how the Western Cape is handling it. This entire program is nationally run, but it at some point devolves to the provinces. Is every province tasked with managing it themselves? How much autonomy do you have? How much of what you're doing is how the national picture is going to be?
Very much what we're doing, Sally, is we're working very closely with our national team, and we're working very closely within the national framework. So there's 4 types of sites we have to bring online. The ones we bring you online that we're directly responsible for is the public sector sites, and therefore the people that's uninsured. It's so important for us to find them, to register them, because primarily our sites is set up to reach the most vulnerable and the people that's uninsured. Then there is going to be mass sites. Now the National Department is working very closely with us. We probably will choose 2 or 3 big ones in the metro. You must understand that we're taking 30, and then towards the end of May, we get 260 Johnson & Johnson vaccine. And then into June, we have an uptake of vaccines. So we will bring the mass site online when the numbers of vaccines that's available is ready for us. Now that is the second line. The third line is getting private sector sites, which predominantly people that has medical insurance. They would have the first port of call is to go there. So there's a range of community pharmacies, chain pharmacies like Clicks, Dis-Chem, and we're working with our private colleagues now to bring that in line into the geographic areas. And the last one will be workplace. So we have a big meeting with all the workplaces on Friday, but we're also starting with the public sector workplaces. You can imagine teachers, police, all have to be vaccinated. We're pulling all of those things together. So there's a lot of moving parts, Sally, but very much what we're doing is what should be unfolding in every province in the country.
All right, that is very encouraging, and good luck for next week. As you say, it's going to be tricky as you try to vaccinate the rest of the healthcare workers and reach out to the elderly in old age homes. But the important message, as you say, is that the elderly must wait for those SMSs in the Western Cape. They will get clear direction of when and where to go, because the last thing we need are super spreader events involving elderly people. Thank you so much. That was Western Cape's Head of Health, Dr. Keith Cloete.